Thank you very much. Assalamu alaikum. I hope everybody is awake. Today you have a wonderful lectures, all presentations during the day. Think that was the cake, and you need a cherry on the cake. So probably this lecture, this talk will be like a cherry on the cake. And I assure you that what Dr. Hussam mentioned, that AI will not take the jobs of the doctors. But if stem cell therapy works in diabetes, half of you will definitely lose your jobs. So let us start talking and see what happens. Uh, this was part of a trial because I started stem cell therapy when I was in the University of Imam Abdul Rahman bin Faisal. In 2014, we started working on that and regenerative medicine, mainly in orthopedics. But slowly we moved from there. Uh, Disclosures, I have nothing to disclose on this presentation. Now, my plan of today was for 25 minutes, but I'll cut down to 20 minutes thanks to Dr. Hussain. Now, one of the philosophers have said before that you have to keep repeating again and again so that things go into the head. Now, the evolution of the disease management over the period of time happened. In 1800s, we always removed the tissue itself as for orthopedic surgeon. But slowly, we changed the pattern for replacement and then repair and regenerate. Right now, the stem cell therapy, the use can produce skin which can be used on burns patients, which is already in the market. The reason why I'm repeating this is type 2 diabetes, particularly, is a major issue in the world. And we see in orthopedic practice those patients coming to us with diabetic foot ulcers, with angiopathies, and all that. Now, I was looking at the GCC data, and unfortunately, Kuwait, the incidence of uh, diabetes itself is about 22%. In As I go along, I am putting some references down so people who want to go and look into the depth of the manuscripts, you can understand what is happening. Saudi Arabia, there's a lot of increase in diabetic patients over the years, and this study was published in 2014, which suggested that the estimated current cost of diabetes in 2014 was 17 billion Saudi riyals yearly. Definitely, that must have gone all the way up in about another 12 years. Now, this classification of diabetes, all everybody knows, but I have just put it in the slide. But what I'm more interested is in the fourth group, which is more beneficial for patients who are opting for stem cell therapy. Now, I'm sure everybody knows all the drugs, fantastic drugs are there. They can control blood glucose level down. We have different insulins, and then we have this Afreeza, which is inhaling insulin. Now, oral insulin is coming. But with all that aspects, what is happening? That about 70% of the patients are unable to maintain the blood glucose level at a normal level. Now, this is happening because of non-compliance, poor adherence, and they have a medication burden which they have to take multiple drugs for so many diseases. Is there any alternative for that, where one-time treatment can take away all the medications? Now, there are three different modes of way which can be used for diabetes type 1 and type 2. A clinical trial which is all ongoing. I'll present that data and then I'll review the literature with you also to see what is happening in the world. Now, reversing type 2 diabetes by reducing, this is how the mesenchymal stem cells work, to reduce the chronic inflammation, enhance insulin sensitivity in the tissues, and potentially regenerate pancreatic beta cells. This is how the mesenchymal stem cell work. Now, indication for particular this clinical trial, which is ongoing now, that they have failure to control with 3 oral medications and with insulin. So that was the criteria to include this patient. It's still open label phase 1 trial, and then the base level monitored was fasting blood sugar level, hemoglobin A1C, C-peptide, and all that. These patients also had a viral hepatitis and HIV profile because before injections we have to do this as a standard procedure so that the unit itself, the interventional radiology unit, does not get infected. Bone marrow is aspirated from the iliac crest. It's a 10-minute procedure uh, under local anesthesia. If the patient has comorbid conditions, then you take it either from the child, son or daughter, or his siblings. Usually, it takes about 2 weeks to culture the mesenchymal stem cells. Before 2025, there was a standard of 5 million dose per injection was done. But the International Society of Stem Cell Research came back in 2025 suggesting that it has to be on the BMI based, that 1 million per kg body weight cells should be given. Now, in this particular study, till now, we have got 10 patients. That was the average age. Duration of their uncontrolled diabetes was about 5 years. After 3 weeks, injection was given 1 million per kg body weight. Post injection, the patient was observed in the hospital for about 4 hours and discharged. Now, if you look into your anatomy, we have the celiac plexus, which divides into the hepatic artery and the gastroduodenal artery, which gives into the superior and inferior pancreatoduodenal artery, which is the main supply. In addition to that, splenic artery is also supplied. Now, this is a small video. I hope it works here. Uh, the injection itself takes about 10 to 15 minutes. Under ultrasound guided, the femoral artery is visualized, and then a catheter is passed through the femoral artery and it goes. And usually, in the initial procedures, I had made it a point that this is my picture on the screen. I was there. I will thaw the cells and I will give the radiologist myself. Once it's injected, 1 cc of normal saline is injected into the catheter to push the cells all the way into the pancreas itself. It is a close-up picture. It goes the catheter through the iliac vessels into the aorta and right all the way up to the hepatic artery and the now this is how it's injected into both the superior and the pancreatic duodenal artery. Now once this is done, the patient is observed for about 4 hours with a good compression package on the femoral artery and the patient discharged. Now, the patients all had 10 patients, a good toleration. There were no adverse events. And the follow up for after 6 months is the results. If you see this one, initially the fasting blood sugar was 118, it dropped to 87, and so as the other parameters which were tested. Now, 8 patients became normoglycemic without insulin and without oral medications, and 2 patients out of that were using insulin 5 units per day. Now, the preliminary results indicate that autologous bone marrow derived MSC therapy in patients with type 2 diabetes is safe, effective reducing the daily requirement of medications and control of the hemoglobin A1C and C-peptide. Now, what does the literature say? This is our part of one study which we have said. Now, the first study came from India in 2014, type 2 diabetes, and their endpoints were requirement of insulin to be reduced by 50% and hemoglobin A1C to be 7%. They injected 5 million cells IV, followed by second injection after 24 hours. And what they reported was that 9 out of 11 patients, that 82% patients achieved the primary endpoint, that the reduction of the medications, reduction of the insulin, and the hemoglobin A1C. 10 out of 11 patients, that is 91 patients, could maintain hemoglobin A1C of less than 7%. That was their aim. And also the glucagon stimulator C-peptide increased significantly in the patients. This was a follow-up of 1 year. Now, another study which came about 3 months ago, this came from Malaysia, where they had 218 patients with type 2 diabetes, same protocol, but here they injected 50 to 100 million cells of allogenic umbilical cord derived MSCs. And they reported that all patients demonstrated satisfactory outcome, whatever their uh, criteria was there to reduce the hemoglobin A1C of less than 6, and at 12 months and 6 months it was being controlled, and fasting blood sugar was back to normal, and then these patients did not have any therapy. Another phase 1 and 2 randomized control clinical trial, which was published in 2022, this was in type 1 diabetes in children. And this also suggested that the stem cell therapy has a very good role in treating patients with type 2, type 1 diabetes in children. Now, this study came in 2024, where they were able to convert the mesenchymal stem cells into differentiated islet cells. Now, differentiated islet cells are those which can produce insulin. This is the study published in 2024. Safe and well tolerated procedure. Post-op after 3 months did not use any insulin. Glycemic control at the end of 12 months. Now, initially, if you see the figure, the top one, that was the insulin level from 2 months onwards, the patient stopped using it. Whereas fasting blood sugar again dropped at after 45 days to normal level and continued to remain there. This was the hemoglobin A1C. Initially, it was 7.57. At 365 days, that is after 1 year, it became 4.76. This is the fasting C-peptide. From 102, it went to 721 picomole per liter. Now, this is how they did. They initially transplanted these cells in the rectus sheath. And if you see that they have reported that they followed by 28 days, 180 days, 360 days, and 365 days, cells were still active, producing insulin for the patient. The risk of this particular treatment by using the induced pluripotent cells is that it has been chemically induced, so that means always there is a risk of tumor mutations. That is the reason why it's practically unsafe at this particular time. Now, this is the paper which very interesting came in about 3 months ago in New England Journal of Medicine. Stem cell derived fully differentiated islet cells for type 1 diabetes. Here they injected into 3 groups just for dose escalating between 4 billion cells and 8 billion cells. But the paper did not mention what immunosuppression therapy they have used because they were using the allogenic cells. But the results were excellently good because at the baseline, the C peptide went up, the fasting blood sugar level went down. Here is hemoglobin A1C for the whole 18 months. If you can see, it has remained uh, below the level of 7, what they intended. Now, the number of patients they use is 12 patients. Now, the concept of islet transplantation is not new. Somewhere in early 70s, Dr. Pybus, who was a abdominal surgeon in Birmingham, he was trying to digest the donor pancreas to see if he can separate the islet cells, but he could not. But in Ohio, Paul Lacey, he was able to isolate these cells, the islet cells, beta cells, so that they can be injected and they used to inject directly into the portal vein. The results of these are very good, but unfortunately, we have to get a donor. The rejection could be high because if it's allogenic, and the cost is tremendous. It's like $150,000 for one-time injection is too high. Now, I was working with a lab in India for my regenerative procedures for orthopedics. They were able to culture the differentiated cells, islet cells from the mesenchymal stem cells. You know, the reason why the drug companies are not favoring stem cells, because whenever you get one type of cell or procedure, it has to be published. So when it's published, any lab in anywhere else in the world can duplicate that. That is the reason why it cannot be patented. Now, in the last 6 months or so, there were three patients where the DIC was injected, and this is two patients which I have the results of this today. Their fasting blood sugar went down from 132 to 101. Hemoglobin A1C also dropped. And then the second patient also the same. These are type 2, the uh, the LADA group of patients. Now, there are a lot of clinical trials which are going on. Some are approved, some are in the process of approval, and some have been suspended, particularly those who have been using the embryonic stem cells because they cause teratomas. Now, mesenchymal stem cell is a wonderful basic cell which has got many different polypeptides which can work. And luckily, last year we were able to separate from the cytoplasm of these proteins. This study will be published probably this month or next month in the World Journal of Medicine. So we are trying to find out which particular peptide out of this will be useful for uh, different diseases. Now, the trials have been increasing over the period of times. At the present time, if you see, there are a lot of current trials going on from phase 1, 2, 3, including diabetes, pulmonary, IBD, bone, skin, and then reproductive medicine and all that. So very soon, this will take over. Now, globally approved MSC-based therapy is in many countries, like Republic of Korea, Japan, Europe, India, Iran, and Canada and China. So this is the treatment which is going to happen. This is the mesenchymal stem cell when you see on the left side, but when you convert them into, culture them into the islet cells, they look like that. Now, options, IP cells, secondary tumors are there, islet cells, donor immune suppression therapy, GVHR is high. Whereas if you try the autologous bone marrow derived islet cells, probably one time procedure will cost you like 800 VD. That's not much for a procedure itself. When your options are limited, look nowhere. You can give a very personalized treatment to the patient. Stem cell therapy, our own experience and the literature suggested it is safe and it can be used in both type 1 and type 2 diabetes. We believe that this type of treatment should be reserved for patients where we as physicians, endocrinologists or diabetologists feel that we are not bringing the blood glucose level under control and when the conventional therapies fail. The center is accepting, I mean, the type 1 and type 2 diabetes with the new methodology of the US FDA, what we call as pay to participate. If anybody is interested, I can help them out. My thanks to the investigating team of this particular study, and which will be published very soon. And stem cell therapy is the future. It was the past as well, but there's a lot of people who are skeptical about it. We are lucky. We want to use all new technology, but we are reluctant to use the new developments in taking care of the patients. Thank you very much of attending this event. Thank you for staying this long. and I hope we'll have some answers. Thank you very much.